Good morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward with another health ministry update. Thank you for joining us today. So, we want to let you know, specifically members of Lake Providence, that we had someone at the August 8th service who tested positive a couple of days later. And we need to just follow up about that. We want to make sure that you understand that it's not time to get hysteric or frightened or scared or however you want to describe it. It's time basically to use common sense, to watch our symptoms, monitor ourselves, and get tested if we develop symptoms. Now, those symptoms that you may remember that we talked about before include fever, sore throat, loss of sense of taste or smell, cough, congestion, runny nose, chills, body aches, nausea and vomiting, unexplained diarrhea. Those kinds of things you want to monitor. And if you develop symptoms, even if you think it's your sinuses and there's a possibility that you were exposed, you should get tested. That's for you and for your household. Now, we've put things in place, protocols in place prior to the reopening to help keep us safe and to avoid an outbreak. And this is one of those occasions that those protocols are very important. And they include things like registration. Registration gives us a record of who was there, who signed up to be there, and we can tell who signs in. That's very important for us to know because in the event that we did have an outbreak, we'd know who to call, we'd know who was in attendance, and who might be at risk along with their families. Another thing that we did is we continued the mask wearing and social distancing. And the reason for this is that both of these, and I put them together because both of these actually decrease the amount of virus that you would be exposed to, that you would be able to inhale. With mask, you have something covering your face, so the droplets in the air, you're not going to get all of them. The mask isn't 100%, so it can't protect you completely, but it does filter out and decrease the number of virus particles and droplets that you would actually inhale through your nose and mouth. Social distancing does a similar thing in a different way just by putting distance between you and the droplets. 6 feet is the first estimate that we got for how far the droplets travel, but then later we learned that the droplets also were in the air as particles. And sometimes the particles are attached to the droplets, but whatever, the droplets and particles may drop to the floor or the ground or other surfaces before you inhale them. The further you are away, the better. We do know, like I said, that the particles can travel further than 6 feet, but at least at 6 feet, you're not inhaling as much of the virus particles as you would be if you were closer. The other thing we have are our hand sanitizer stations. We've asked that we not congregate, shake hands or hugs, and I know that is so abnormal feeling. It's just not natural, but it's necessary at the time. And if you do happen to hug or shake hands or whatever, it's important that you wash your hands because, again, you can be exposed to someone who doesn't know that they're sick. And that just is another way to decrease the possibility that you might get sick. It also decreases the chance that it's a more severe illness. The more virus you get into your body, the more sick, the more severe the illness that you would likely have. Another thing we do is we clean and disinfect the church after each use. And this is according to CDC guidelines. So that's another way that we try to keep the surfaces clean. We know that the surfaces are not the major way that this is transmitted now, but surfaces can gather droplets, and that can get on our hands, which goes to our faces and into our respiratory tract that way. So that's another way to decrease the amount of viral exposure that we have and just to keep us safe. If you feel that you have symptoms develop, remember, get tested. This is for your safety and for the safety of your family, and so that you know when you come back to church that at least you tested negative. This is a very difficult time, but we believe God and His Word, and that He's going to take care of us. We know that we have a part to do. We have a part to play in this. And when we do what we need to do, we are assured that everything's okay because we're being obedient. He's given us medicine and science to help us. And I'm thanking Him for it every day. As always, stay safe, stay healthy, and stay prayed up. Have a blessed week.